I want to come back to Dr. Nobel. The UnLonely Project launched a program called Stuck at Home Together, which provides tools and resources to people to engage in creative activities and find ways to connect socially, as we've all talked about being so important. It strikes me that this program would be of value not only during the pandemic, but also, pre-pandemic, post-pandemic. I'm just wondering, though, how has this project or others that you may be working on shifted your thinking about the kinds of resources that you and the UnLonely Project would like to create? Kind of what's the future for the UnLonely Project?
Obviously, we're thinking quite a bit about that. And I really like what both Marjorie and Darcy talked about in terms of levels of risk. People are out there and, we often use the metaphor, Marjorie said triangle, we call it a pyramid, the pyramid of vulnerability. So if you look out at the world and you imagine a pyramid and there are 3 layers, the first layer of the pyramid of vulnerability is all of us. We're all vulnerable to loneliness at some point in our lives. We've all experienced it. The next level are people who, because of some kind of precipitating event, in this case, it could be COVID-19 isolation, but in more regular times, it could be loss of a loved one. It could be loss of a job. Something tips you into that next level of risk. And so you're not experiencing serious mental illness at that point. You're just feeling increased distress and so on. It's when that's not addressed that you go to the highest level of risk. When you start experiencing such distress and anxieties that could take you into an acute anxiety disorder, or panic disorder, depression, suicidality, or substance abuse. So where we've been focusing with the UnLonely Project is actually at the bottom tiers. So that how do we give people a kind of vocabulary, a language, a sense of mastery of how to connect with themselves and others? You mentioned stuck at home together. I think within weeks or months, we won't be so much stuck at home together, but there will be a shift in the social patterning, for instance, in the workplace for at least a year, where people will come and some parts will be virtual and some parts will be face-to-face, but with social distancing. So you're not quite in your same familiar surroundings. So I think we're going to see not just the acute phase, which we may be fortunate to get through in the next few weeks, but then a prolonged phase where 2 things will be going on. One is ongoing risk for loneliness and isolation because of the altered social connection model. But the other, and this is something we take very seriously, as I know Marjorie and Darcy do also, is a post-traumatic stress acceleration in some significant mental health issues. We're very concerned. Unfortunately, almost certain depression rates will go up, suicide rates will go up, addiction rates will go up. So when we think about what we at the UnLonely Project could do going forward, it's really to work at the base of the pyramid, to give people the tools and skills for reducing loneliness risk by connecting with other people and pointing them towards resources that as they feel that they're getting beyond what they can handle in a self-care model or a community care model, they can get prompt access to the professional levels of help they need. And as you mentioned, Eli, this will go beyond COVID-19. We are really encouraged by the positive response we've had to very simple creative activities, streaming short films and watching them online, sharing, little creative prompt responses, doodles and so forth in ways that connect. So in a way, COVID-19, as burdensome as it is teaching all of us how to be a little more comfortable with loneliness and hopefully equip us with the tools to address it.
Thank you, Jeremy. And you raise a great point with regards to the second phase of this pandemic. And I wanted to turn to Marjorie because I think we've all heard it of that second pandemic that's coming, which is the mental health pandemic. And just looking to the future for Psych Hub, how are you all currently thinking through your strategies and resources and what you're creating? Where are you looking to go next with the offerings for Psych Hub?
It's a great question. And I think someone said it earlier, we all moved to telemental health in a hot second, right? So everything's moving at an accelerated pace, which is a good thing, actually, a good thing to move in the right direction. So we're looking at strategic partnerships with other organizations that have on, different types of resources adding on to ours to be able to really offer a more end-to-end solution. And those are, everything that you can imagine, from delivery of telemental health, because I think in a certain sense, we're going to find that yes, people will go in for mental health treatment, but getting it online is not going to go away. No shows have gone considerably down using telemental health. It's a very interesting, statistic that we've now learned. So how do you make that better? How do you make that more effective? We're working on that. We just released a free course on telemental health for providers, and that was like a level 1, and we're doing more in-depth levels. So we're focusing more on providers and getting them those interventions that look a little different than we thought. A big push of ours right now is out of COVID is the access issue, is getting what we're calling a lighter version for paraprofessionals, peers, coaches to use interventions. We are working with hospital and health systems, some of the largest in our country, huge demand for them on getting their providers trained up. So we're focused a little bit more on the whole greater ecosystem than where we started. It was just on the licensed behavioral health provider. So I think that's a part of it. I think the other piece, just to kind of piggyback on Jeremy, is that, what he said at the end is so important, which is that we're getting more comfortable with loneliness. And I think that's so, that in a way is something that's come out of this. It's not something you're never going to feel. But is it, with all the stimulus we have in our lives, whether it's social media and going out and all of that, that's, now maybe learning how to find that, I think you said also, Jeremy, earlier, the authentic connection and figuring out how to do that. I think that's where we all need to go. So we're very focused on the self-care pieces. We just launched our very first relaxation video, and I think it's had, I don't know, like thousands and thousands of views within the first few days, because people are looking for those types of kind of easy ways to kind of decompress. So I think that we've got lots of exciting things ahead.
Fantastic. Thank you, Marjorie. And I want to come to Darcy. So another aspect that Dr. Nobel had spoke to was how we may be coming back to a very different workplace. So Darcy, it does seem increasingly likely that many of us are going to come back to a very different workplace, or not come back to a workplace at all. And we see more and more organizations completely going virtual. In this type of environment, what new role does the employer play in supporting mental health? And I think you spoke to this a little bit earlier, but would love to come back to it. How should employers be thinking differently about how they provide support?
Yeah, great question. And I want to return to this issue of telemental health that Marjorie raised, because we have worked with some psychiatrists who said, I have patients that I've been seeing for years and they love this new modality. They don't want to see me in the office anymore. So I think this is really, really helpful for access. But I also want to really compliment something that Jeremy said, which is the word vulnerability, because we've been sort of developing this new model called LEAD, which we're recommending employers really consider following. And that is leadership as the L, the important leadership issue. And normalizing mental health at the leadership level is so critically important, because leaders set the tone and culture of organizations. So the more leaders are willing to show vulnerability, to talk about mental health openly, I will say workplace mental health over the last 2.5 years has been a very, very hot topic. It was true before COVID-19. I suspect it will be doubly true after. So the good news is employers recognize there are high costs, human costs, and bottom line costs to not addressing mental health in the workplace. I suspect they're going to see that's an even greater need now. So when we get to LEAD, the second issue really is effective communication, because what we want to recommend to employers is they share a whole lot more information with employees, especially with working remotely. Routine, systematic, sending out of information. We all have mental health. We need them to be providing information to employees about things like taking care of themselves, stress management, the importance of addressing resiliency. We know there's been much more interest in mindfulness and meditation and offering guided sessions of that for employees that are interested, that want to tune in. It's going to be a lot more virtual offerings that go to mental health and wellness around sleep, around diet, around exercise. So all of those things on the preventative side that help to contribute to people's mental health. The A in LEAD is really adapt to change. So employers are going to have to really look very carefully at their policies and practices, their managerial style. Expectations are going to have to be really reset for a while during this transition period around productivity, deadlines, expectations, stress levels, managerial style. So we want to make sure that employers are really thinking about how is it we adapt to change so that we can ensure people take care of their mental health, make sure people set schedules. We know people are working longer hours now that they're home. That's not necessarily good for them because that leads to additional stress and they don't necessarily have the kind of balance they need in their lives. And then finally in the LEAD model is double down on access. Again, I talked about this with the EAP, with the health plan. It is really essential to look at your data. It's essential to have two-way communication with your employees on challenges they're facing in accessing care. And then making sure your EAP data is reflecting the fact that we know now depression, anxiety, trauma, substance use are on the rise. And the last thing I'll say is we're developing an e-learning module, training module called Notice, Talk, Act. Notice the early warning signs of mental health conditions. Talk by starting conversations with people you're seeing those kinds of early warning signs with and knowing how to act to connect them to care. The reason this is important is we know from surveys that the APA put out in May of 2018, national surveys, people are not comfortable talking about mental health at work. This is managers, this is employees, they're not comfortable sharing it. We need to continue to make progress in helping people feel psychologically safe in coming forward and having conversations about mental health, both when they need care themselves and they need support and services, and also if they see concerning patterns in someone else. And then finally, I would say something that employers are doing more and more of, and they were doing it before, I think we'll see more of it after or once we kind of transition back to whatever the new normal is the development of ERGs, employee resource groups. And Marjorie mentioned this, peer support, affinity groups around mental health, around caregiving, because many people are taking care of loved ones with mental health issues, and really just creating new ways of connecting. You can do this as we are through virtual meetings. You can do this by offering the opportunity to meet at social distance, physical distance in the office when people return in different shifts. So really thinking creatively around creating these new groups that focus on mental health so that people can support each other through the process of transitioning back and then in a post-pandemic world.
Thank you very much for that, Darcy. And I want to thank you all for joining us this afternoon. This has been a great conversation, and you've shared quite a number of resources that individuals can tap into, and I hope that folks really do. But you've also given us some hope for the future as well, and some thinking that we need to do around how we can modify how we're living, how we're connecting with others, how employers can think about how they're taking care of their employees. So I just want to thank you all for your contributions this afternoon, for your time. Greatly appreciated. And take care.